Welcome to the Synergy Medical Coding Academy video on ICD-10-CM coding for the cardiovascular system. This video will provide an overview of the cardiovascular system, which includes the heart and the circulatory network. The cardiovascular system consists of three main components: the heart, the arterial system, and the venous system. The heart wall has three layers: the epicardium, the myocardium, and the endocardium. The myocardium makes up the majority of the heart's mass. The heart contains four chambers: the right atrium, the left atrium, the right ventricle, and the left ventricle. Heart valves control blood flow between chambers and out to the arteries. These include the pulmonary, aortic, tricuspid, and mitral valves. Blood flows through the heart in a specific direction, ensuring oxygen-poor and oxygen-rich blood are separated for efficient circulation. This diagram further illustrates the direction of blood flow through the heart and the systemic and pulmonary circuits. The cardiac cycle involves atrial systole, ventricular systole, and a relaxation phase, coordinating the filling and pumping of blood. The heart's conducting system, a network of specialized tissue, initiates and coordinates the heart's contraction without external intervention. The primary heart sounds are S1, or lub, from the closure of the mitral and tricuspid valves, and S2, or dub, from the closure of the aortic and pulmonary valves. Blood pressure is measured as systolic pressure during heartbeats and diastolic pressure between beats. A normal range is generally 120 over 80 millimeters Hg. The circulatory system comprises arteries, which carry blood away from the heart, and veins, which return blood to the heart, connected by arterioles, capillaries, and venules. The coronary arteries supply blood to the heart muscle itself. Major branches include the left and right coronary arteries. Symptoms of cardiovascular issues include chest pain, breathlessness, palpitations, and edema, among others. We now begin the section on ICD-10-CM coding for the circulatory system, which uses codes I00 through I99. ICD-10-CM Chapter 9 addresses diseases of the circulatory system, codes I00 to I99. This diagram illustrates the systemic circulation. Chapter 9 categories cover a range of conditions, including rheumatic fever, hypertensive, ischemic, and cerebrovascular diseases, as well as diseases of arteries and veins. Hypertension is persistently raised blood pressure. Primary hypertension has an unknown cause. High blood pressure can lead to severe health issues like stroke and heart failure. Blood pressure ranges classify individuals as healthy, elevated, or in various stages of hypertension, up to a hypertensive crisis. Hypertension coding involves several categories, including essential primary hypertension, hypertensive heart disease, hypertensive chronic kidney disease, and secondary hypertension. Code I10 is for essential primary hypertension. R03.0 is used for an elevated blood pressure reading without a formal hypertension diagnosis. I11 refers to hypertensive heart disease, which is often coded with I50 for heart failure, as hypertension is a common cause of heart failure. I12 codes for hypertensive chronic kidney disease, combined with N18 codes specifying the stage of chronic kidney disease, such as N18.31 for stage 3A. I13 is for hypertensive heart and chronic kidney disease, requiring codes for I50, heart failure, and N18 chronic kidney disease to be used concurrently. I15 is the code category for secondary hypertension, which is high blood pressure caused by another underlying medical condition. I16 is coded for hypertensive crisis, which includes both hypertensive urgency, I16.0, and hypertensive emergency, I16.1, or an unspecified crisis, I16.9. Coronary artery disease, CAD, refers to the hardening and narrowing of the arteries that supply the heart. I25.10 is used for atherosclerotic heart disease without angina. CAD is primarily caused by atherosclerosis or arteriosclerosis, leading to plaque buildup in the coronary arteries. Ischemic heart disease, IHD, and angina pectoris are related conditions, where ischemia signifies decreased blood supply to the heart muscle. Myocardial infarction, or MI, is the death of tissue due to ischemia. This occurs when the heart muscle is deprived of oxygenated blood. Acute myocardial infarction, or AMI, is a life-threatening condition where blood flow to the heart muscle is abruptly cut off, often due to a coronary artery blockage. Code I-22 is used for subsequent acute myocardial infarction, which includes both street elevation or STEMI and non-street elevation or NSTEMI infarctions. The code I-25.2 is assigned for a history of myocardial infarction, indicating a previous MI without current acute symptoms. Hypertension can lead to complications such as heart failure, where the heart cannot pump enough blood to meet the body's needs. ICD-10 classification for heart failure is categorized under I-50. It can be classified by severity, including acute, chronic, acute on chronic, or unspecified. Acute cerebral infarction, also known as CVA or stroke, occurs when there is a sudden loss of blood flow to an area of the brain, leading to tissue damage. The code for a history of CVA is Z86.73 and is assigned when there are no residual effects from the previous stroke. Sequela of CVA refers to the long-term or residual effects of a stroke, such as paralysis or difficulty speaking. Peripheral arterial disease is a circulatory condition where narrowed blood vessels reduce blood flow to the limbs, typically due to the buildup of fatty deposits and calcium. Deep vein thrombosis, or DVT, is a disease of the veins involving the formation of a blood clot or thrombus in a deep vein, usually in the legs. This concludes our session on ICD-10-CM coding for the cardiovascular system. Thank you for watching this video.